Thank you everybody for attending tonight, and let me take you through our presentation. Okay, let me carry on quite quickly. Small change since the last month or two. We're not building it out, but we've added John Sheridan at the bottom of the slide now to Senior Vice President Clinical Operations. John's job is very important on the announcement today. We now have 3 clinics, and we started this time last year with 1. So John is in charge of all the clinics. That frees up my time considerably now to really drive the business ahead. I'm still head of business development and driving the machine ahead. So I think John has been a fabulous joiner. He, believe it or not, he came for competition. So we're making sure SGS doesn't give us any trouble. And he ran our only competitor in the continent, that was SGS. We hired most of the challenge study team, the CHIM agents, and they're on board. And now we have John. So other than that, it's business as usual. We've Elena Sullivan, lots of knowledge in virology, and Elaine is a new NED as well. So she's been absolutely brilliant. Quick snapshot, the really important part of this, I think everybody's waiting. We are profitable. We made bloody good money in Q4 last year. Every week, every month going forward, we are generating cash and profitable. So that's why I think a new clean, fresh slide, it looks good. So I think over on the right-hand side, investors information, really importantly, we now have no debt. There was a small bit of legacy debt to do with the Venn acquisition. So that now is a couple of hundred, and that is just minimal debt. You see we've over 20 million in the bank, and we're generating cash every month and profitable. So I think from the investors, some people say we should make an RNS, and that my view is, well, it's there, we're profitable. We will do a trading update in the months ahead, but it's very, very clear we're in good shape with 3 offices. And I'll not go through, I think most people have seen that. I really want to get the rest and tell you where all the bits are. So I think that's the most important one. We're profitable, and we're in good shape, and we're generating money. Business overview, I think most people have seen this, so I won't dwell too long on it. Other, as you notice, we're losing the names. People are getting confused with Venn, with hVIVO. We're basically, very simply now, with the London office, we're the world leader in doing challenge studies. And the roots in the London office goes back to 1946 when the British government established the Salisbury Flu Clinic. It continued to into 89, which some of the last employees set up RetroScreen, and that was John Oxford, 89. And RetroScreen changed its name to hVIVO about 15 years ago. So we've a long history in this. Originally, we had 1 quarantine unit. Now we've access to all free for the UK government COVID work, and our own new one now in Whitechapel across the road. I'll talk more about the men. Then we have the Paris office. It simply provides data management and biostats to a lot of small and large French companies, and it's fully integrated, provides the same services to our own challenge study. And our Dutch office. So it's really nice to have all 3 offices now working seamlessly and generating money. And you see along the bottom, our core skill is we're dealing with virtually every vaccine manufacturer in the world, either current customers or recently past customers or future ones. So it's a nice business to be in at the moment. Progression, really multiple challenge studies. We're just a handful of them here. And the beauty about the business now, it's not 500,000 contracts, they're 3 million, 4 million, 7 million contracts. So we're now knocking out a contract every month, which is great. We've did profitable. October, the really important one. I think people didn't believe it, but you probably would have seen we didn't make a song and dance on it. It's up in the government procurement website that they have given us a 46 million contract. That's not bad. Again, some people said, why did you not do an RNS? Well, we did tell everybody, if you look at the RNS clearly back last October, we had to get 6 million more. So that work, I'll come through that in a minute, is working our way through it. And the other one is, I'm going to come to that, disease in motion. We're really excited about what we have now on our digital platform with the wearable companies. And we've now patented that into almost a standalone business. And let me come to that in a few minutes. We're looking at monetizing non-core assets. So I have a slide on those as well. The most important part of the business is we have unprecedented growth opportunities there. It's a work that focuses on infectious diseases. So COVID, we all know, look at Pfizer. Pfizer announced earlier this morning that its COVID vaccine, purely its COVID, will give them $15 billion in revenue this year. And that's only one of the providers. That vaccine, with The new, unfortunate mutations, or we call them variations, mutations there to frighten us all, will require new vaccines. It's going to be very difficult if most of the world is vaccinated. How do you test out a new one? So it's going to make challenge studies more important than ever, because all we've got to do is find 100 people and test the vaccine on every one of them. So imagine trying to do a very large challenge, a community study now with a lot of the people getting vaccinated. So the benefits of challenges has never been more important, but really importantly, we're not COVID dependent. The bulk of our work, most of the new deals we're on is RSV, influenza, COPD, pneumococcal. So there's a big, I hate to say it's almost like a gold rush across the world to spend an absolute fortune on developing new vaccines. For 30 years, the world spent nothing on vaccines. It was seen as a poor cousin to everything else. And then we have the pandemic. So now in the year ahead, you're going to see an enormous amount of money. COVID is fixed. Now, there's just going to have to be an awful lot of newer versions. Going forward, we'll be told, take your annual flu jab, and when you're at it, take your annual COVID jab. So that's how it's going to pan out. The big pharma companies are going to make a lot of money. But the good part is, this time last year and early last year, nobody knew would the vaccine work. And the great part is it's rolling out and it's definitely working. But as the disease mutates and changes, like the flu, there's going to have to be new vaccines. So that's where we are. We're sitting right in the center of the action. More importantly, the next generation ones, and we're in the thick of that. We started earlier this month testing phase 1 on the Codegenics. It's nasal, so it's needle-free. It hopefully will give 5 to 7 years. I'll come to that in a minute. And it doesn't require deep freeze. It can be stored at normal fridge temperature, not even frozen. It's a live attenuated virus. That means the entire COVID virus is in it. It's attenuated, so nasty side. And as such, the company is hoping they'll get 5 to 7 years immunity. It will also protect against new variants. So yeah, this is really exciting, but this is only the first step. We've got this one, and we're hoping that might be our first challenge study this summer, because we've started with the phase 1. The beauty about doing a phase 1, it always automatically leads into a challenge study. Not alone is this one, we're already in discussions, and watch this space in the coming months. There's a good bunch more contracts on next generation COVID, and that's the benefit of the position we're already working on the next ones. Very importantly, as we've really cranked up capacity, and I can't be so excited about what we've done with the third centre. Say we have the traditional one, with the Royal Free, and now with this one. But in addition to that, we have to have a way of screening volunteers. And this pandemic has been very unfortunate. There's a lot of empty coffee shops. There was one of the larger coffee shops in East London. It was a Costa one. It was part of our building. It was the ground floor. It was lying idle. So we've managed to convert that. We had to pay for the money. We didn't pay the money in the hotel. I'll come to that in a minute. But this one, a modest investment, and we now have a dedicated screening centre. So between that and again, an unused facility, so it was great in Manchester, we could put it to use. We're getting these facilities at very, very cheap deals. We can put over 520 volunteers through our slots per week at the moment. And we need them because we're really cranking up our trials in a big way. So that's one in Manchester. Both of them have opened literally in the past month. And bear in mind, before, we had a single screening centre. We can have more of these pop-up centres going forward. This is the really exciting one. I know I've been hinting for several months that people thought we were going to Asia, people thought we were going to Europe. But guess what? We didn't have to go. We went across the road. And East Google is a beautiful 27-bed, quite boutique Whitechapel. It's known as Whitechapel Hotel. It's now known as the Whitechapel Clinic that we have. The conversion wasn't particularly expensive because each room, if you notice, the floor already was sealed. It wasn't carpet. That's a big part. But it did take a certain amount of money. And what happened here? We are booked out until Christmas, and a particular large pharma company wanted to jump the queue, and we said we couldn't do that, and they wanted the data, so they said they would pay us to try and do the trial somewhere. The problem with the trial, you have to the quarantine, you have to the staff, you have to the viruses and the models. So guess what? Not alone to pay for the conversion, they also paid for the first year rent in the hotel. That trial will use up about 20% of the hotel, and that means we have now 80% to sell, and we already have it almost booked out for the first half of the year on all our trials. So we're really excited about that. But again, we're doing what we're paid to, is to make money go a long way. Disease in motion, this is a really exciting bit. So rather than just going off and do one limp deal with one wearable, we decided, you know what, let's patent this. This could be a really viable standalone business as well. We're playing games with all the large wearable companies, and this is a really exciting space. So I think you'll be seeing lots of details as our wearables, and it's called, with a patent called Disease in Motion. It includes the world's largest database of infectious disease prescription disease, and that can power wearables. It's very clear that people now who've got COVID, who had their Apple Watch and Fitbit and the rest, you could see a very large spike in heartbeat and also strange temperature monitoring. So we can deliver the data to these that can give indications to wearables as to what type of disease, not just COVID, not just influenza. It can be COPD, it can be a whole range of other diseases. So this is really exciting. I'm not going to dwell on this, but hVIVO Open Orphan now is probably the best known brand in the world of the vaccine business service provider. We are getting inquiries from every vaccine manufacturer in the world. I'm going to call at 7 o'clock tomorrow morning, and we have 7 of the largest CEOs of the Chinese companies all on it, and the head of the Chinese FDA, which is called the CDE. That would have taken us forever to get one of those a year ago, and now we have all 7 of them, plus their head regulator at 7 a.m. tomorrow. So that's it. This company is utterly transformed in a positive sense. Even we'll be tweeting out tomorrow morning. Finance, or Yahoo Finance Live, their TV finance program, wanted an interview today about, believe it or not, what was going on in Whitechapel with a new clinic and what was going on with the next generation of vaccines. So we'll tweet that out tomorrow morning. Really importantly, I know quite a few are getting impatient, say, Cathal, what the hell, where are we going on this? So all I'm saying is we have delivered the 3rd clinic. Probably surprise you. That 3rd clinic is going to generate very substantial additional revenues this year immediately. Monetizing non-core assets, we've broken them into 3, and let me talk you through them very importantly. One of these 3, we will be hoping to have a very positive update in the not too distant future. It's well underway, so let me wait till that's ready. So it's one of the 3, and then the other 2 will monetize not long thereafter. Immutex, I know some of you are concerned. You saw the Conserve V on the web. That's basically just our joint partner. We own 49% of these assets. Our colleagues in the Seek Group own 51%. The Seek Group is more or less rebranded, because I think they don't have anything left in their portfolio. They had some other assets. The rebranded is Conserve V. They are attempting now to, and we're delighted with if they can work away. But some people are worried. They're saying they own Flu V. The 2 real assets, clinical assets. Flu V has passed phase 1, and or Mosquito has passed phase 1, and Flu V has passed phase 2. They're the assets. They do have some other contingent preclinical assets, and we all know how little value preclinical is. We're delighted with what they're doing, but please everybody bear in mind, nothing can happen to those assets without our permission. So we're backing them, and if they can pull off this monster deal they're talking about, we'll be the first guys to sign the bottom line. So rest assured, that asset's going to monetize and is in safe hands. We'll ensure it's not going to disappear. Prep Pharma, work in progress to be monetized, and watch carefully, repurpose immune. You're going to hear a lot more of that in the not too distant future. So I can assure you, we're probably a month behind where we should have been, but work in progress. I know I'm running tight in time, so I'll go in conclusion. We've recently been nominated as one of the top 10 CROs in Europe. We're profitable with a world leader, very broad customer base, pipeline of lots of them, disease in motion, and we're actively working towards monetizing all 3 non-core. We've broken our non-core assets into 3 separate groupings, and all I can say, watch this space. We are a little bit behind in that. We got ahead of the posse on the new clinic, but bear with us, because we're going to have a really exciting couple of months coming up. And on that, I think I'll pass over for Q&A.
And just to say again, thank you so much for all your questions. We've got more than enough time to go through, so apologies in advance if I don't get to ask yours, but we'll try and do as many as we can in the time allowed. So in no particular order, Cathal, There's obviously a bit of or quite a lot of key man risk for open orphan. Would you consider extending your personal lock-in period beyond June 2022?
Absolutely. I think I've never sold shares, even in Amrit, which I was a co-founder. I'm still sitting on my stake. So I think my only plan would be probably buy more shares if I'm allowed. That's where I'm at the moment. So the plans we have ahead for this year, it's so exciting. I've no issue. There's an orderly market beyond June. So that means I can't really sell unless there's a broker. So I can absolutely assure you, I will not be selling shares anytime this year. The only announcement I'd see about shares is probably increasing my stake, if I can. Bear in mind, I'm an insider. Most of the time, there's only a very tight period where you can do anything, but it won't be selling, it'll be buying if I get a chance.
A lot of people have been asking about when they might see or when you might achieve contracts or first deals in the disease in motion part of the business.
Yeah, what we could have announced several deals at this point in time. We did say we looked at doing an exclusive deal with one of the very large wearables, and then some of the other ones. And then we said, hang on a minute, this is actually a really valuable, almost standalone business. Hypothetically, not saying it could be spun off into a very large IPO. So that could be a fourth non-core asset. And we're making it very clear, each of the assets non-core as they get monetized, that cash has gone back to all shareholders. So I think there's going to be a series of cash handbacks, could be very substantial, through dividend species. So that what we're doing very carefully, rather than doing a quickie deal there, we've now built a platform. It's patented. It's disease in motion. And I think it could be in a point where every wearable company in the world will want to work with, because they cannot get that data anywhere else in the world.
What specific challenge studies will be run at the new Whitechapel facility, given it's not negative pressure?
Yeah, great question. And that's somebody who knows their onions. QMB is negative air pressure. But for most of our studies, RSV, the only ones we need negative air pressure is the COVID studies. And we're hoping that we're optimistic we'll have ethics approval in the, can't say when, but not too distant future. The minute that ethics approval of our COVID-19 challenge study comes, and we're very optimistic as to when it's coming, we crack on. We start on with the COVID-19 clinical trials on behalf of the UK government. They're huge trials, so we're freed up space in negative air pressure. There's negative air pressure, 24 beds in QMB. There's negative air pressure in the 19 beds in the Royal Free, and there might be some more beds in the Royal Free than that. And that's where it is. So there's freeing up beds in anticipation there. And we also bear in mind, part of it is the QMB is totally booked out till Christmas anyway. So that's it. So yeah, traditional challenge studies can all be done across the road in the Whitechapel clinic.
Has the genomic database arm of the business been shelved? Rare disease data was part of the original investment case for me. Will there be an RNS on this in the future?
Actually, the question is, we're actually even now looking when our challenge studies are bringing in rare disease work. So now the genomics database is building and growing, and that makes it even more interesting to wearables, because we've used the original platform database we built pre-IPO that supports genomics. So that's all part of it. So absolutely the buy-in on the genomic database, and that's part of the reason how we very quickly have developed almost a standalone business that could be as valuable as the parent company, the disease in motion platform. And the genomic database is critical to that platform. We have the infectious disease aspects, but now we have the genomic. I mean, you put the two together, it's a fantastic business.
Was the revenue from the £46 million government contract recognised last year, or will it be recognised this year?
Some of it last year, but the bulk of it this year.
I know you've been asked a lot of time about the share price, and you said before you're happy to comment on it. And so I'll ask you, what is your position on the almost static share price? What the question was asked, in my words, and why do you feel that is?
Clearly, one of our largest shareholders, Invesco, they've been in for 10 years. They are selling down. We're hopefully, maybe tomorrow morning, our Chinese friends might buy them out. We would like to buy them out. And we saw that happen before when we had IP Group selling at this time last year. Until they actually sell out, or until we buy them out, they have a bit of lid. But I think we're going into this year. and I would be never more optimistic. I think the share price is going to have a pretty exciting 6 months coming up. So so the share price has been flat because yet the seller, as soon as they stop selling, either through sold down or hopefully we get them bought out, you will see some serious action. I think as well, to date, they didn't want to take a bid from us because they're kind of saying they too want to try and sell out as the market nudges up. But do bear in mind they've been there 10 years. So no, as regards to share price, I've never been more optimistic. I think, wow, we're starting a whole new year. We've a lot of work done and we've a lot of good news flow coming in the weeks and months ahead.
Question about a broker note from FinCap, not including the turnover from their second or third facility in their target rating for Open Orphan. There's thoughts here, I think, that the guidance from FinCap suppressing the share price. Could you comment on that at all?
Yeah, look, I can't really comment too much the FinCap note other than, yeah, as the largest shareholder, I'd love to see the guidance much higher. I think we were probably going to do, we're a bit naughty. We didn't really involve them too much in the third facility. And again, we read the note, didn't really see much revenue attributed to it. Our plan this year has of all three facilities full chock-a-block and maybe start very quickly looking at a fourth facility. And that's where the magic of our business, it takes us, we can have a fourth, another hotel. And unfortunately, this pandemic is very difficult in some industries, coffee shops and hotels, but we're able to get them on short leases, minimal upfront. Yeah, so I think what I would suggest is that FinCap are a good broker, but yeah, we've got to get them up to speed of where the business is. That's probably the best way I'd say.
And a lot of questions on dividends. Any news on a dividend?
Yeah, we've got plenty of cash in the bank. We could easily pay a dividend. You will see us going to the court pretty soon. Look, we have to, as most shareholders know, we have a lot of retained losses, so we've got to create what's called distributable reserves. So with the option, we can start paying out some of that cash. But I think a far bigger dividend will be each of the three non-core assets. And I did say, watch that space. One of them is getting closer. There is three of them. And believe it or not, all three, Immutex, Prep Pharma, and that last one that sometimes watch the last quiet one, the immune modulator, will be monetized. And we will update the market pretty soon on one of them. That's all I can say. It's not there yet. As soon as it's there, and that will be done via dividend species, so all shareholders will get a result of that monetization event.
Cash in the October presentation was around 22 million pounds, and we've been told to expect about £1 million a month added going forward. So just wondering why there's been a drop, albeit small.
Yeah, well, we paid back the Venn loan note that was outstanding. That was £1.5 million.
Okay, and I think we're probably getting to the end of the questions. Any thoughts on a USA clinic or overseas?
I think where we are looking at the moment, and particularly if you think these new mutations, like the United Kingdom has proven the world leaders in vaccines. We're way ahead of everybody. So I think we'll take most of the growth here. We could actually have a fourth clinic, 100-bed hotel, converted at minimal cost and not too far away. So I think rather than sometimes going overseas, what's wrong with doing it here at home? Like Great Britain, and bear in mind, the vaccine rollout by our current government is making headlines all around the world. I got my vaccine yesterday. I waited every one of our staff, because we're frontline workers. We have a lot of COVID positive patients walk through our door every day for volunteer recruitment. So because we have so many live COVID patients in the place, we were entitled to be. So I insisted every staff member got vaccinated. So a bit like the skipper in the ship, I had to be the last person, but that rollout is happening very fast. And my belief is if there's going to be another clinic, a fourth one, why not go large and have it here, not too far away.
Lovely. Cathal, thank you very much indeed for presenting this evening and giving us an update.
Ron, thank you very much, and look forward to a very exciting year ahead of us. I've never been more excited.